Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about Trazodone. Trazodone is an antidepressant. It was brought out as Deseril in 1981. It was developed as a second-generation antidepressant, but it's not used very much as an antidepressant. In fact, it's used mostly as a treatment for insomnia. Now, it doesn't have FDA marketing approval as a treatment for insomnia, but it's used extremely commonly. In fact, it's among the top 25 drugs prescribed here in the United States, and this year there will probably be about 25 million prescriptions for the drug. By some estimates, it's used as a sleeping pill more commonly than Ambien, that is approved as a sleeping pill. The reason? Well, it's not a controlled substance. There's no limit on the number of prescriptions, no limit on the number of pills, and somehow it's gotten the reputation that there's much less problem with abuse or dependency or rebound insomnia. Nonsense to all. The dose of the drug, if it's going to be used as a treatment for depression, it's going to be 50 milligrams 3 times a day, 150 milligrams total course in the day to start, then gradually increase by a dose of 50 milligrams every 3 or 4 days up to the maximum dose of 400 milligrams. It's suggested you take the drug with meals or shortly after meals because there's some erratic absorption if it's taken on an empty stomach, but whether you take it with food or without food, 65% of the drug is going to be absorbed. It's just if you take it with food, you get a higher blood concentration, a higher maximum concentration. Caution, obviously, with sleepiness. And because of the sleepiness, most of the drug might have to be taken at bedtime rather than throughout the day, or maybe you have to take a reduced dose. Well, because it made people so sleepy, others got the idea, why don't we use it as a treatment for insomnia? And in fact, that's what it's now prescribed for. It's principally used for insomnia, in spite of the fact that the American Academy of Sleep Medicine recommends that it not be used as a sleeping pill. But a lot of doctors falsely believe that it's safer than other sleeping pills. They worry about the benzodiazepines like Restoril, or they worry about what are known as the Zs like Ambien or Lunesta. But those have been studied and those are approved, and those appear to be very safe when used appropriately. If we look at Trazodone as a therapy for insomnia, there's no established dose. There are few studies to support its use. The studies that have been done are small and they're short-term and they're not blinded and they're used varied doses. They didn't have any placebo. They just asked the people, hey, how you feel? Oh, I slept okay. But a lot of the people who were studied were actually depressed because, remember, it was an antidepressant. So how does it work on people who aren't depressed? Do we have any studies? Well, here's one. They looked at Trazodone versus Ambien, week number 1. Well, it seemed to work equally well. Week number 2, Trazodone worked about as well as a placebo, while Ambien was still providing benefit. And another group, the Cochrane Collaboration. Cochrane Collaboration is a worldwide organization that rates medicines and is free from financing by the drug industry. So it gives us as unbiased information as we can get. They say, well, it has a moderate improvement over a placebo as far as subjective response when they ask a patient. On the other hand, if you look at the differences in sleep efficacy when the patients are studied with a polysomnogram, one of those monitors, there isn't any difference. What's the dose? Well, if you're going to take it as a sleeping pill, it's a low dose, maybe 12.5 milligrams a night or 50 milligrams a night. But sometimes people are given prescriptions for 100 milligrams a night or even 300 milligrams. There isn't any standardization. Reports suggest that it might increase your total sleep time, decrease the amount of time you lie awake before you fall asleep once you go to bed, decrease the number of times you awaken at night, decrease the time you're awake in the middle of the night, increase the slow wave sleep, the deep sleep, the stage 3 and 4 sleep. Probably doesn't do much on the REM sleep. But remember, there is no good evidence to support its use, and as a matter of fact, it is not approved anywhere in the entire world as a sleeping pill. even though it's widely used as a sleeping pill, and it's estimated that as many as 1% of the general population here in the country is taking Trazodone as a sleeping pill. Now, according to Consumers Report, you want a sleeping pill? You'd probably be better off taking a Benadryl or a Unisom over the counter, relatively few side effects. The drug was developed in Italy in the 1960s as a second-generation antidepressant, but it quickly developed a negative reputation because of side effects. Side effects, not the least of which were that sedation and orthostatic hypotension. People would stand up and their blood pressure would fall down. And it would fall down so low they weren't perfusing their brain. They got a little dizzy. Some of them fainted. You can imagine an elderly individual getting up at night to go to the restroom, getting dizzy, faint, fall, break hip. Not a good idea. And then it caused cardiac arrhythmias. Well, fortunately, soon after the development of Trazodone, the SSRIs, Prozac and Paxil and all of those, came into existence. So Trazodone wasn't used much as an antidepressant. But if we look at its effect as an antidepressant, it works as well as any other antidepressant. All of the antidepressants seem to work about the same. Doesn't make any difference what antidepressant we're talking about. As far as treating depression is concerned, they're all pretty much equal. Now, some people respond better to one drug or another. There's difference in cost, and certainly there's difference in side effect profile. But as antidepressants, they're all pretty much the same. So it doesn't matter whether you take a tricyclic antidepressant, a drug like imipramine or amitriptyline, or whether you take a drug in the SSRI family, the selective serotonin reuptake inhibitor family, Prozac, Paxil, Celexa, or if you take an SNRI, Effexor, whether you take Cymbalta, whether you take an MAO inhibitor, they all are about the same. Now, if you do take the drug as an antidepressant, and if it seems to work, then you could consider tapering to a lower dose, maybe a lower dose that would be associated with fewer side effects. You have to be cautious. If you happen to have a history of mania or bipolar disorder, this drug isn't for you. And if you're taking the drug, you can't just stop it abruptly. If you do, you'll have a withdrawal syndrome. A withdrawal syndrome that could be mild or very severe. It could start with some nausea and excessive perspiration and irritation and agitation, headache and dizziness, and peculiar electric shock-like feelings, especially in your extremities, or pins and needle feelings in the extremities, or sometimes people develop tremor or anxiety or confusion or lethargy or insomnia or seizures. The drug should not be used in women who are pregnant. In animal studies, pregnant animals, well, they reabsorbed the fetuses, and the fetuses that weren't reabsorbed were born with congenital anomalies, so not a good idea. Lactation used with caution because, remember, the drug is going to be passed into the breast milk. So probably not a good idea to take this one during pregnancy. And you have to be careful if your kidneys or if your liver aren't functioning well because of the metabolism of the drug. And as with all antidepressants, this one carries a black box warning label by the FDA, and it says basically that be very careful of an increased risk of suicide, especially in those individuals less than age 24. If suicide is going to occur, it tends to occur during the first 4 months of therapy, unknown risk afterward. What are the other side effects that make this drug not very popular as an antidepressant? Well, number one is the drowsiness. So you can't function all day if you're drowsy. It causes dry mouth in about a third of the people, headache in about 1 person in 5. Then it also causes blurred vision and syncope. It causes confusion, and it causes fatigue, and it causes either weight loss or weight gain. And it can precipitate attacks of acute angle closure glaucoma. And it has the potential to cause cognitive and motor impairment and impaired judgment and thinking, impact negatively on your motor skills, so you have to be cautious driving a car or operating machinery. And it can cause a decrease in the blood pressure when you stand up that can lead to that dizziness and fainting we talked about, but it also can cause heart rhythm disturbances. It can cause premature contraction of the heart or an extremely rapid heart rate, so rapid that you faint. Or it can increase something on the electrocardiogram known as the QT interval. And when that happens, that predisposes you to arrhythmias that might end up with ventricular fibrillation. Could cause death. Should not take this drug if you've just had a heart attack during the recovery period of a heart attack. And because the drug works on serotonin, it can increase the likelihood of bleeding, from a bloody nose to bleeding into the skin to life-threatening hemorrhage from the gastrointestinal system. So you have to be careful if you're taking this drug in addition with some other kind of a drug that impacts on the clotting or the bleeding. So you've got to be careful with aspirin or non-steroidal anti-inflammatory drugs. Drugs like ibuprofen or naproxen. You have to be careful with antiplatelet drugs and other anticoagulants like warfarin or Eliquis. And interestingly, it can cause priapism, a prolonged painful erection lasting more than 6 hours that obviously needs medical attention. It occurs most frequently in people who have rare conditions like multiple myeloma or certain leukemias or sickle cell disease, but it can happen to anyone. Risk is about 1 in 6,000 at any age. Usually occurs within the first month or so of therapy, and typically at relatively low doses, less than 150 milligrams a day, so the kind of dose you would be taking for a sleeping pill. It can cause a low sodium, what we call hyponatremia. So if the sodium gets too low, that could be a major problem, especially if you happen to be an elderly individual or you're taking a diuretic, water pill for your blood pressure maybe, or you're volume depleted because you haven't been drinking enough, you live in the desert, it's the summertime, you're outside working. Symptoms of low sodium can be nonspecific. You could have a headache or difficulty concentrating, or you could have impaired memory or confusion or weakness, maybe unsteadiness, but it could progress to hallucinations and seizures and fainting and coma, even to respiratory arrest and death. Now, there's a condition known as the Serotonin Syndrome, and the Serotonin Syndrome is when there's too much serotonin floating around in the system, and that's one of the ways that Trazodone works. It increases the amount of serotonin, and if you take the drug by itself, or if you take it with another drug that works on the serotonin, you may be liable to develop this serotonin syndrome. And the other drugs that you have to be cautious of would be the triptans that you would take for relief of acute migraine headaches, or the tricyclic antidepressants like the amitriptyline or the nortriptyline, or the SSRIs, the Celexa and the Paxil and the Prozac, or the SNRIs, the Effexor, Cymbalta, the MAO inhibitors and tryptophan and St. John's wort and Buspar, and even fentanyl. What are the symptoms associated with serotonin syndrome? Well, autonomic instability, so the heart rate shoots way up, the blood pressure way up and way down, dizziness and flushing, your body temperature can go up, you can become agitated and hallucinate and develop delirium or even coma. And some people develop changes in the muscles, tremor or rigidity, or the muscles seem to just contract. The reflexes increase, people can become incoordinated, and then they can develop gastrointestinal symptoms, nausea, vomiting, diarrhea. They can develop even seizures. Do not take Trazodone within 14 days of taking an MAO inhibitor, and you have to be careful taking other drugs that might change the metabolism or the amount of Trazodone in the system. So you've got to be careful if you're taking the clarithromycin or erythromycin or rifampin or St. John's wort. And because of its effect on the cardiovascular system, you have to be careful taking this drug with other drugs like amiodarone or sotalol, commonly used heart medicines, or even some of the antipsychotics, the drugs like Abilify, or certain kind of antibiotics, or digoxin, or phenytoin, called Dilantin, or DPH. If you overdose on this drug, it's probably not as bad as some of the other antidepressants if you take it by itself, if you overdose on just this drug. But if you overdose on the drug and you've been drinking alcohol or popping Valium or taking some opioids or some barbiturates, then the likelihood of drowsiness and vomiting and cardiac arrhythmias and a blockage in conduction of the impulses from the top part of the heart to the bottom part of the heart that tells the heart, hey, beat, People develop priapism and respiratory arrest and seizures and death. Well, it's labeled as a selective serotonin reuptake inhibitor. So just by reading the package insert, you would think, aha, this is a drug just like the Prozac and Paxil, but it really isn't. It's called a serotonin antagonist and reuptake inhibitor, an SARI, a separate family. It's different chemically than the tricyclic antidepressants or the MAO inhibitors or the SSRIs. The drug works on serotonin transmission and norepinephrine transmission. That's the way it seems to work. But if you take it just at a little low dose, it seems to work on the histamine receptors. And when it works on the histamine receptors, that seems to be one of the ways in which it might cause people to go to sleep. Might be that you need a higher dose to work as an antidepressant. Well, the drug is metabolized into another chemical, and the other chemical actually can antagonize the way Trazodone seems to work. The half-life, once you take it, is about 7 hours. So if you're not taking it multiple times during the day for depression, you could take it just at night, and it's probably going to be pretty much metabolized by the time you get out of bed. It seems to have two peaks where we have the blood levels, somewhere between 3 and 6 hours, sort of early, and 5 to 9 hours, kind of late. It's going to be altered if you're a smoker. You're going to metabolize it much more rapidly. It's used as an off-label treatment for certain other kind of complications of the SSRIs. Now, this probably is not a good idea, but it's sort of gained traction because the SSRIs can interfere with sexual function. That's relatively common. And sometimes the SSRIs cause insomnia. So people say, well, why don't we combine the two? If you're depressed, maybe we could use a low dose of each. But remember that serotonin syndrome that we talked about. So the studies were discontinued. However, some people are still prescribing the combination. That's not necessarily a good idea. And the drug's used off-label for a variety of other indications for which there is not any good information to suggest that it's of value. So it's used as a treatment for certain anxiety disorders or panic, for alcohol dependence, for erectile dysfunction. It's used to improve the libido. It's used for obsessive compulsive disorder, or a pain syndrome that we used to call reflex sympathetic dystrophy, now has a new name, complex regional pain syndrome. It's used for some people with post-traumatic stress disorder, depression after a stroke. It's used even for cocaine withdrawal. Some people go through what's known as foraging. They keep searching for a little last drop of cocaine that they might have missed. Well, this seems to help that. And it also seems to help the cognitive dysfunction that goes along with early dementia. And it's been used for painful conditions from fibromyalgia to headache or migraine, to people with back pain or people who have diabetic neuropathy. Well, the good news about the drug is it might work for insomnia in some people. And certainly there's low risk for abuse. The bad news is that it causes some psychomotor retardation, a feeling of low energy, causes sedation, causes a variety of other cardiovascular side effects. So it's a little more risky than some of the pills that we have that would do the same thing, but do it more safely. The drug is inexpensive because it's generic for a long time, so you can buy the drug for less than $15 a month. They came out in 2010 with an extended release form for use in depression that you would only have to take once a day. It's called Eleptro, but it costs about $100 a month. So as far as Trazodone's concerned, it's an antidepressant. It's not very popular as an antidepressant. It's used as a sleeping pill, but it doesn't have marketing authorization to be used as a sleeping pill. No studies confirm that it really is beneficial. And in fact, it's not approved anywhere in the world as a sleeping pill. The American Academy of Sleep Medicine recommends against the use. So what should you do if you have problems with insomnia? Well, you should watch some of my videos. You watch the video on insomnia, watch video on melatonin, watch video on some of the different kind of sleeping pills. But But I think if you have insomnia, you can probably do better than this medicine. I wouldn't take Trazodone. Anyway, thank you for watching. I'm Dr. Ken Landau.